First of all, let me say that the content of this video is indeed me, Gregory Malchuk, appearing on the Ralph Retort, the kill stream, several months ago to fight with callers on the topic of infant circumcision for about 2 or 3 hours. That is indeed what this video is, but for a few minutes I'd like to take a detour into a related topic and why I think it is important for intactivists to view this whole video. I'd like to take a moment to talk about intactivist media interactions and how they might be improved. In interactions between intactivists and the media, and actually intactivists and the public at large, this is generalizable, actually. There are several criticisms I have, but the main one is that intactivists are just too nice. They just don't treat it as if it's a confrontation with a hostile entity when it essentially is, especially with the media. I mean, when dealing with the public, it's a bit of a crapshoot, although I think you should present yourself in a certain way overall, and I'll explain that in a moment. But it has the feeling like intactivists are seeking media or societal approval, and I don't think we need to do that, especially with new things like the parent-child interface strategy of protesting circumcision, where kids and parents meet, be that at schools, outside churches, at boys' sports league games in public parks, at amusement park gates, etc., etc. This is essentially a guerrilla warfare, a culture jamming strategy designed to bypass the media and actually bypass the average members of the public and take the fight straight to where it needs to go. In terms of interactions, it's not really a heuristic. In other words, there's no algorithm I can give you that is the key to good interactions. In general, I can give you a couple pointers, and then we'll get on to the real point of this video, why it's going to be 2 or 3 hours long. Hostility. There needs to be some hostility, especially with the media, and even with the public in general. These people are not your friends. Some triumphalism. We're going to win this. We need to sound like it. The fact that circumcision started in this country as a Victorian-era anti-sex campaign that never stopped, like the origins of this are never fully hashed out. The fact that the people that claim that masturbation caused hairy palms and blindness and epilepsy are the real reason that you're missing part of your penis is relevant and needs to be conveyed to people. The history of female circumcision in America. Yeah, I like talking about female circumcision, but not third world female circumcision. I'm talking about constantly reminding the medical field that they circumcised girls in this country. Up through the 1970s at least, with Patricia Robinette convinced that it actually continued right up until the ban in 1997. And the fact that the American Academy of Pediatrics pushed to re-legalize it and re-legitimize it in 2010. Douglas Diekema was responsible for that. The fact that female circumcision has medical benefits, as documented by Kanke et al. And Stallings et al. Stallings was a Western female anti-FGM campaigner who was looking for anti-FGM propaganda and found the opposite, and surprisingly didn't destroy her results, actually published them. And the use of the phrase cutting off parts of babies' penises. I made an entire previous video about this. This phrase just makes it so stark, and it makes it so indefensible. And it conveys what's actually going on, and it's just totally indefensible. So that phrase is good. In general, I want you to behave like the Joker. Or Lex Luthor. In other words, hostile and sort of happily hostile, with a mischievous grin across your face. Now, to the point of the video. I was on a talk show some months ago called The Ralph Retort, or I believe he calls his show The Kill Stream. They invited me on to talk about circumcision. They had seen me pestering them in their live chats, and I had started to acquire a bit of a name for myself for doing this all across different venues on YouTube live streams, and they invited me on. And what ensued was about 2 or 3 hours of me fighting callers, all kinds of people, random men in denial, dumb women, cutter mommies, even a pediatrics resident, a doctor in training. I fought. It bears explaining because it looks like he's friendly, but he's actually not one of us. I may explain that further in a future video. I actually explain it in real time on the show. But anyway, I want my interactions with, well, technically with a doctor and with media people, but with the public at large, I want this to become a model for how intactivists need to act with interactions with the media and the public. And it's very different to what you've heard to date. It's hostile. We're at war, and you need to come across as more hostile. Like I said, think the Joker, think Lex Luthor, and so without further ado, I give you Gregory Malchuk on the Ralph Retort. Enjoy.
Let's bring on the anti-circumcision master, Gregory Malchuk. Gregory, you're on the air live on the kill stream. Uh-oh. Can you hear us?
Oh, hello.
Hey, what's up?
What's up, man?
Yes. Hello, this is Gregory Malchuk, your resident anti-circumcision crusader. What can I do you for tonight?
All right, so we're going to open up the lines. Let me I think the Discord link in the chat now works, by the way. If somebody wants to go at Gregory, we'll see how long this goes. It was kind of a spur of the moment, so we don't have an official opponent, but I figured that there might be some people in the chat that wanted to go at you. So
yes, all pro-circ trolls and haters are welcome to come fight me.
It's an open invitation. That is correct. Okay. Here, I'll place the Discord link in the chat as well. So, how you been doing, man? Have you been following some of this drama outside of the circumcision stuff?
Well enough. I don't know. I confess, I don't follow much of this. I hadn't. I paid attention to the Bloodsports for the the Spencer versus Sargon kind of material, and the recent crashing and burning of everything has had me quite dismayed, quite depressed.
Do you think the Jews might be behind this?
I don't. I wouldn't venture to guess that. Right-wing movements have a tendency to have too many chiefs and not enough Indians, and the personalities can begin to clash. And I don't. Perhaps that's a large part of it.
The chat said yes. I said yes. The Jews are behind this.
It always is. It's always them.
It's always them. All right, let's just start bringing people in. I don't want to waste any time here. I see some people in chat really love my joke. One person told me to kill myself. Okay, I'll look into that. Let's see. Let's try Dongwave first. Dongwave, what's up?
Yo,
man?
What up? You can hear me okay?
Yeah.
Yes.
Yeah. I'm actually I don't have any problem with the circumcision. Yeah, with the circumcision argument. So
then what are you doing?
No, I'm just here to chill. The green room was open, but since the circumcision guy's on, I do have a related question. What do you think of the movement for the regeneration of foreskins?
Yes, thank you. I'm actually fairly well on top of this. I talk quite a bit, and I always throw out there as clear political goals that there needs to be a circumcision ban, punishment for the perpetrators, and number 3, there must be a coherent effort by society and by the government to fund tissue regeneration initiatives to regenerate our foreskins and make our bodies whole again. And this last point is not optional. I'm not going to relent until it is clear that all three of these pillars are being worked on.
Yeah, I'll be honest with you, I think that's a bit extreme. I think the guys working on the regeneration thing have got it down. I think the overall trend of having circumcisions at birth is declining. It's more or less in the Jewish region now. Let that be their issue. And I think if we all just chill, eventually we can get our regenerated foreskins. Or, it's kind of hard to make a big deal about it because I don't know what the alternative is. So I'm just going to live with what I got for now.
Yes. The situation on the tissue regeneration front is both promising and gives us reason for caution. There's a few people working on it. There's an organization called 4Gen, which has been...
That's the one out of Italy, right?
Yes, Enzo. They're working on some things. There's been talk lately. They're severely underfunded. They're a nonprofit. They take funding mostly from private individual sources, and they're severely underfunded. They get a lot of criticism about, are they actually doing anything? I don't blame them for this. They simply don't have the money, which is why I am focused on securing government funding for this program.
All right. But here's my problem with the government funding thing. All right. Yes. I don't recall there ever being a government push for circumcisions. Correct me if I'm wrong. Really? I may be wrong on that. I don't recall there being a government push.
The resident circumcision promoter is a Jewish individual by the name of Jono Merman at the CDC, who runs all over the place promoting circumcision. That's the government. Medicaid covers circumcision in about half of the states. We have a small project called the Medicaid Project, which is quietly working to strip Medicaid funding for circumcision, but it still happens. This is the social contract with the male in this country is broken within hours or days of being born. This is why I say there has to be a coherent societal and indeed government-funded effort to make men whole again.
Let me ask you this. Chat is saying you're a Jew and you're LARPing. You're trolling us right now. Is that
me or him?
No, not you. Him.
Me.
Yeah, you.
Why? I mean, I don't. If I was a Jew, I don't think I'd be.
I mean, that's the entire point. Is the whole point of them calling you a Jew is that, well, you wouldn't expect a Jew to be anti-circumcision, so that's otherwise there's no point in just calling you a Jew for no reason.
No,
you follow?
My ethnic makeup is Northern Italian.
And I'm not the chat. I'm not questioning your ethnicity here. I think you're just genuinely really against circumcision. I understand that, but if anything, I would argue that while the things you've brought to my attention about the CDC and Medicare have some more issues to bring up, the real blame lies at the feet of the parents, especially non-Jewish parents, because they had no cultural or religious doctrine telling them to do this. So, what say you to come to as these parents being held responsible for these decisions they made?
This is a very good question. Let me finish up the last point.
Right,
let me make a few other things clear. We spend millions of dollars on foreign charities to reverse female circumcisions. We're spending about $1 billion to develop a hypersonic cruise missile, which will never be used in conventional warfare. The circumcision industry itself is a $1.5 to $2.5 billion a year business. So I don't think it's unreasonable to say that we could and should pour large amounts of money into this, and it would yield dividends beyond it. I mean, stem cell research and tissue regeneration is not just the holy grail of genital integrity, it's the holy grail of medicine itself. I mean, it offers tantalizing possibilities, including organ regeneration and potentially biological immortality.
All right,
to the parents.
Go ahead, finish up though. Don't go on 20-minute monologues. That's what I'm saying.
Oh, sorry.
Yeah, go ahead. Now finish up what you wanted to say though.
Oh no, that's about what I wanted to say about that.
Okay.
On the topic of the parents, for the sake of expedience, I tend not to shout about the parents much, but I really have to say it is truly, it's truly depraved that parents do not think about this, that they have such a strange and perverse, domineering attitude over their children at birth, that they feel the need to do this, where the decision is made somewhere at the intelligence level of look, Jimmy needs to look like daddy, and mommy thinks foreskin is gross. Ooh. My protest strategy regarding this, because I have clear, I don't just have an agenda, I have a protest strategy that could help achieve the agenda. And that includes something that the anti-circumcision movement has not really done to date. That's target the parents, or the parent-child interface. And I plan on doing that by protesting circumcision at schools, churches, boys sports league games. Sorry.
Okay. There was a couple super chats concerning this. Adolf Hogg said, well-being, anti-circumcision, at least we know he's not a kike. He just likes the tip of his dreidel to carry bacteria. That's what Adolf Hogg said. Logical conclusion of tolerance said, Americans now get more foreskin cut off than ancient Jews ever did if you look into it. They only got a little bit cut off. We get the whole tip skin off. Do you know about that?
Yes, I think we may have actually talked about this.
Yeah, I think we did. But
we may have talked about this last time. The ancient Judaism, it's thought that they only removed the part distal to the overhang of the tip, and this would have left probably near complete glans coverage when flaccid in the adults. When the Greeks took over Syria and Palestine, and eventually the Romans, the Jews were very conscious of this by virtue of the culture of public nudity in the gymnasium. And they began restoring their foreskins using something called the Judaeus pondulus, this set of weights that they would use to stretch out, because the Greeks liked long foreskins. And anyway, the late temple...
Yes or no, he's right with what he's saying, though, right?
Yes, okay. Yes. The Jews made it much more radical because they didn't like their people.
Okay, we're going to bring some other people in. Dongwave, you got anything else before we drag you out?
No, not for now. Thanks for having me on. Cheers.
Thanks, I'm going to throw you in the general.
Cool. Yeah, thank you. Throw him in the general. Confiscate his coat.
It's a good...
All right, so we're just going to start dragging people in. I see hypocrites also in the green room. But there were a couple people there earlier, so let me try, because I saw this guy on there the other night, and I don't think he got in. Sir, you're on live on the kill stream with anti-circumcision activist Gregory Malchuk. And you're still muted, by the way. All right.
3,
gone.
2,
He's gone. Okay.
Next,
yeah, I'll drag somebody else in. Kenny, you're on the air.
Hello?
Yes,
hey.
Hello.
Oh shit, I'm on the air?
Yes.
Oh, what's up, dudes?
What's up, man?
Hello.
Hey!
What's going on?
Dude, I played a fucking game. Holy shit.
Okay, we're here with the anti-circumcision activist. Do you got anything to say or challenge him on?
What are we talking about?
Circumcision.
No, yeah. I mean, would you cut off your fucking daughter's labia or whatever? No, hell no. I mean, I'm circumcised and I don't like it.
All right.
Yes, we have a hypocritical double standard in the law of this country that's existed since 1997. You can't cut off your daughter's labia, clitoris, clitoral hood.
Yeah, you cut off your
open
son's
season on the
fucking
foreskin.
dick? That's not cool.
It's not cool.
It's not cool.
Sorry, I'm fucking so distracted right now. I'm sorry.
Well, thanks, buddy. I'm going to throw you back in the general, all right?
All right, that's cool.
Yeah.
All right, peace out, dudes.
All right, peace out. Let me drag a hypocrite on. Before that, we had a super chat. Shadowlight Jones said, just say, why do you care so much about baby dick, my dude? End of debate. Why do you care so much about baby dick, Gregory?
Well, why do people care so much enough to strip a baby naked and tie him to a plastic circumstraint board and cut off part of his penis? People try to characterize me as the pervert. I mean, my God.
All right, fair enough. All right, let's drag somebody else in. Let's drag a hypocrite in. A hypocrite, you're on the air live on the kill stream with anti-circumcision activist Gregory Malchuk. How you doing, sir?
Hey, good. What's going on, Gregory?
Hello.
quick question, man. What is it about having a big flap of skin that repulses women and makes them not want to put your dick in their mouth that you find appealing?
I don't know that that's true at all. There have been surveys on this topic. 89% of women who have experienced both do in fact prefer the intact male. But in general, I mean, let's be clear here. When it comes to sexual preferences,
okay, you're saying women prefer uncircumcised dicks? That can't be true.
Women don't know their ass from a hole in the ground when it comes to sexual preferences. I mean, I just, it doesn't matter. Women tolerated the intact male for, I don't know, several 100,000 years of the anatomically modern man. They will get over this 100-year fetish.
Maybe we should Google this, Ralph.
I mean, yeah. I mean, I'm willing to look up what's going on. Let's, so
for the love of God, don't Google baby dick.
You're gonna be on a list for that one.
Just the study itself, yeah. My wife said most women don't care. All dicks are weird. LOL. That might be true, actually. Yeah. What did Band was in the chat earlier, and they asked her. She's from New Zealand, of course, so most men there are uncut already. And she said, first she said that, and then she said, "Doesn't really matter to me. They both look like a naked mole rat," which I thought was pretty funny. But.
Yeah, I found a survey on Thrillist, and it was like 4-1 prefer uncut versus prefer cut. But like half of the people had no preference. But for the people who do have a preference, it's like 4 times more likely to prefer cut.
There's nothing more manly than cutting off part of your penis to please a woman.
And the people who are like saying no preference are probably just trying to be nice, if we're going to be honest about it. But you don't think it's manly to cut off part of your dick to please a woman? How is that not manly?
Well, the part that makes you a man is kind of getting partially amputated.
No, it's getting groomed. It's getting improved.
Well, when I think grooming, I think hair, which is dead when it leaves the follicle.
Okay, so we've established you don't like sex, but what is your actual problem with circumcision?
Infant circumcision is genital mutilation, and genital mutilation is wrong. It is wrong when it happens to a girl in the far reaches of East Africa in some village. It's wrong when it happens to a girl in Southeast Asia in a clinic, because it's medicalized there, let's be clear. And it's wrong when it happens to a boy in the maternity ward of an American hospital.
Boys and girls are different, though. You know that, right?
They both have the same human right to physical integrity, not to have their body cut apart at birth. But a woman doesn't need her clitoral hood.
Well, but it is doing something for her.
What's it doing for her?
Keeping it sensitive, right? That's why they get rid of it, right?
Really? Well, why do you think you have a foreskin?
Yeah, but most guys don't have most guys have a problem lasting long enough, if anything, right? So they don't need, if anything, they benefit from being less sensitive.
This notion of lasting longer, it seems to be a canard created entirely by circumcised men to defend their state. I've talked to different women on this issue.
Well, if you're less sensitive, you're going to last longer. Is that not how friction works? Like less sensitive means you need more friction? I mean, it seems pretty straightforward.
No, I mean, you might think that, but the fine touch sensitivity, which engages much before orgasm in the intact male, in some way seems to prolong it. And women report this. Women report that intact men do in fact last longer, that the stereotype is completely backwards. There are other changes in
I feel like you're just giving me a bunch of anti-circumcision propaganda that could be debunked with Google searches.
I mean, do boys have human rights or don't they? Like, I mean, I'm just throwing this out there that they cut off the most sensitive part of your penis with a razor blade. You might be a little bit dysfunctional because of it.
It's not the most sensitive part.
It is the most sensitive part. Sorrells et al. 2007 show that the ridged band and the frenulum of the foreskin are the most sensitive parts of the penis to fine touch.
Okay, so even if that's true, haven't you heard that what doesn't kill you makes you stronger? How do you know it's not good for boys to be circumcised?
What doesn't kill you makes you stronger.
What the?
Does it make the part of your penis that's rotting at the bottom of a landfill stronger?
Who cares about that? That's the old you.
Well, heck, why not cut off the whole thing? Cut off the whole thing. You don't need it to stay alive. They can suck the sperm out of your balls and impregnate your wife. You don't need your penis. This is a definitional epistemological problem, which is that this is part of you. You don't get to draw an arbitrary dotted line through the penis and say, "Oh, we're going to throw that away," and then the rest of you is just doing better, and that's healthy. No, that is a bastardization of what it even means to be healthy. Health is about the health of the entire body.
I mean, humans do body modification, though.
Now let me.
You can't get a tattoo.
You clearly don't. It's clearly not necessary for health.
Now let me ask you this, hypocrite. So yeah, humans do body modification, but I mean they're doing it to children, like little babies that don't really have a say in it. So it'd be a little bit different than an adult going to get it done, right? Yeah,
that's true, but that's because it's the best time to do it.
What does that mean? Is there any burden of proof on that?
Well, it's just when they're not going to, because it hurts, obviously. So the best time to do it is when they're not even going to be able to remember the pain.
Like female circumcision or date rape. Do it in infancy or with the amnesia of a quaalude, right? She won't remember it.
Yeah, I mean, these are such ridiculous arguments. Like, circumcising your kid is not the same as date raping a woman or cutting off a girl's.
You just said that they won't remember it. That the amnesia of infancy is an acceptable reason for doing it then. And so I propose to you, how is it any less acceptable?
Right, but the thing
for date rape. I mean, quaaludes
good and rape is bad. That's the difference, right? So you want to get circumcised, but you want to do it at the optimal time. You don't want to get raped.
I don't want to. I don't have any intention to.
Guys who want to have dicks that women like. That's who.
Okay, then you have to ask them at the age of majority, at the age of consent, what they want. This idea that you can... I mean, this is so screwed up, the idea that you can say, oh, he might want this, so I'm going to cut off part of his penis and leave him with no recourse, and then lean over his shoulder 20 years later and say, oh, you like your mutilated dick, don't you, son? That is depraved. That is a depraved paradigm.
Okay, but did you say that you're not circumcised? It seemed you implied that when you said you have no desire for it.
Yes, I'm intact.
Wow, so this is where all the insecurity comes from. All these dudes are out here with better looking dicks that women prefer. They're lasting longer in bed, and you're like, oh, it's not fair. It's not fair. Oh, no one should be able to have it if I can't have it.
I don't like to do this. I am very sensitive to the idea of shaming circumcised men because it I mean, for goodness sake, your penis looks like a fucking burn victim. The exquisite
You can't think this is actually going to work on me, dude. I've seen the surveys. I know what women prefer.
The ridged band.
I don't care what guys think about my dick. I'm not interested in what you think about my dick.
It's not pretty.
I care what the women think.
The women like your circumcision scar is so sexy.
Now let me ask you this, hypocrite. This is kind of an American-centric thing, right? So in the UK, it's not normal to be circumcised. By far, most men are uncut. In New Zealand, we talked about earlier, it's like that. Mainly, most other countries besides the United States, circumcision is the exception and not the rule. So what? I mean, does that change anything that you're thinking, or I guess not, since you live in the United States, but. I just thought I would ask.
I mean, I'm in Canada, but it's pretty common here too. But I just feel like if it was common,
in
other places, then they would know what they're missing. You know what I mean? Like, it's easy to not know what you're missing if you don't have.
Yeah, that's depraved. I mean, is it? How is that a moral point in favor of circumcision?
Getting more pussy is not a moral point.
If I gouge out a kid's eyes,
that's the only thing that matters in life, man, is getting more pussy.
Don't you want to feel it when you're inside of it?
Don't worry
you kind of
about
want to be able to feel it? Where in Canada are you located?
I'm in BC.
British Columbia. Okay, yeah, British Columbia does have the highest rate of circumcision in all of Canada, along with Alberta. In places like Ontario and Nova Scotia, it's almost completely gone.
Yeah, the cucked provinces. Imagine my surprise.
The overall rate is still very low. I mean, it's far below what it is in the United States. Your country is easily majority intact. You do know that, don't you?
I don't care if it's like what the majority is. If that has no like Ralph just asked me about that for other countries. That has no influence on my opinion about it. Literally the only thing I care about is what the women prefer in that, because I don't see any downside to it. But if there's an upside, then obviously you're going to do it.
I care about objective human rights and ethics. And women's sexual preferences have no impact or bearing on those.
Well, we can agree to disagree on that.
I guess so. We'll just leave it there. Hey, man, hypocrite. Thank you for joining us, man. We're gonna drag some other people in, but yeah, I do appreciate you coming on.
Peace.
All right, peace out.
Thank you.
Okay, so we got some other people. That was good, though. That was good. I'm glad we got some adversarial guests here. We got another one, I believe, that wants to go at you too. So we'll bring him in. SoCal Chris, you're live on the kill stream with anti-circumcision activist Gregory Malchuk. How you doing, sir?
Pretty good, bud. Can you hear me?
Yes, I can.
I have a question for this guy. He's either a really good troll or doesn't know what he's talking about. From a health perspective, and there's significantly higher rates of penile cancer, yeast infections, prostate cancer, diseases, and many other things from not having circumcision done. So he's either a really, really bad or good troll. What he's talking about.
How on earth would the world go round if we didn't have circumcision? I mean, the majority of the world is intact, and they don't have massive outbreaks of these problems. So the average age of onset of penile cancer is somewhere near 70, and the occurrence rate is near 1 in 100,000. If you cut off any part of your body, if you cut off part of your body, by definition, you can't get cancer in it. Penile cancer in men is rare, its onset is late, and it is easily treated.
You're talking about foreskin, you dumb shit. You're not talking about the actual penis. The penile cancer, you can still get disease, and
it can begin. Yeah, it can begin in different parts of the penis. Yeast infections. Do we circumcise girls for yeast infections? Men actually typically don't get yeast infections. They get bacterial infections. Yeast infections are rare, and they occur mostly in diabetic people.
HIV, herpes, warts, you name it. I mean, this isn't
the Africa AIDS studies were entirely agenda driven.
Hearts or livers or
we're entirely
instead of some social justice bullshit.
The Africa AIDS studies were highly agenda-driven by the Western circumcision enthusiasts, and there's actually great debate over them now because it's now spiking the AIDS, the HIV transmission rate in places like Malawi. I will also say that according to...
I don't live in fucking Malawi. I live in the United States.
That's even less of a reason to get circumcision. The prevalence of HIV here is even rarer. You're much less likely to get it. Are you having sex with East African prostitutes?
Pretty sure that's the only way you get some.
All right. According to Kanki et al. And Stallings et al.
No, you skipped over.
Just hold on a minute.
Hey, dumb shit.
I'm talking about it. I'm engaging you on it.
All right, go ahead.
According to Kanki et al. And Stallings et al., these were two independent studies in, I believe, Tanzania and Senegal. Female circumcision reduces the HIV transmission rate by 50%, about the same that is claimed for men. Do you support a regime of female infant circumcision to reduce HIV transmission?
I mean, it just.
Do you?
I can't say yes or no because I haven't looked into that part. I've looked into.
Oh, but it's the health benefits, buddy. I have my health benefits. You can't do this. You can't claim amputation and genital mutilation as a preventative measure.
Fucking skin.
It is amputation. The 1999 American Academy of Pediatrics statement called it amputation of the foreskin. That's straight out of the horse's mouth.
Okay, you're telling me that you want to take the risk of a child growing up and having issues because of said foreskin because he's promiscuous or some other reason, and have a better chance of getting that disease. Snip when you're born, don't remember shit, and then you're all right.
These claimed changes in STD infection rates are minuscule, and in certain diseases, I believe chlamydia, it's thought to increase it.
What about the 20 times the risk of penile cancer?
Again, it occurs in 1 in 100,000 men. The average age of onset is 70. And it's easily treated. If you cut off part of the body, you can't get cancer in it. If you cut off part of the penis, it's that much penis that you can't get cancer in.
All right, you're talking about fucking foreskin. Basically, you can't put yourself into a better position in life to do something with hearts and livers. You have to make your hobby worrying about other guys' dicks.
I mean,
I'm just curious.
There's a couple things at play here.
This type of work. Do you think? Well, you know what?
Genital mutilation is a cause well worth working on. But beyond that, you're playing this relative privation fallacy game of there's worse things in the world. You should be working on this. You should be working on that. I don't pay this any mind. All the haters can pound sand.
No, you're just the fucking dumb shit that Ralph had on so we could all laugh at. That's the only fucking thing you're good for.
I don't know. Well, check the chat. A lot of them seem to agree with me. There's a lot of mutilated American men that agree with me. That are pretty fucking angry that this society raped them with a razor blade at birth.
Oh, someone raped you? That makes a lot more sense now.
What?
This shit.
All right. He meant that rhetorically speaking. SoCal Chris, you got anything else?
I'm done. Get this loser off.
All right. Thank you, sir. All right.
Have a good evening.
I have two people I want to drag in.
Wait 1 second. I promised that I would read the super chats after that guest, and we'll bring somebody else in. Shadowlight Jones said, "Why do I have a feeling this guy has had the anteater pointed to and laughed at? I know what I'll do. Make it my life's work to make mine the norm." Shadowlight Jones then said, "Could you imagine being this guy and obsessing over another dude's dick more than King of Paul?" Adolf Hogg says, uncircumcised Wang carry more bacteria and have a bigger percentage of gaining a urinary tract infection due to that fact than do circumcised. Chalet Jones said, just come to grips that you have a weird dick, man. Random Loser 88 said, is Muslim female genital mutilation the same as male circumcision? Could you answer that, Gregory? Do you know the differences between the two procedures?
Yeah, somebody said something about urinary tract infections. Girls get urinary tract infections at a rate of 4.5 to 10 times the rate of boys. They treat them with antibiotics, no problem. Between male and female genital mutilation, keep in mind, female genital mutilation is defined down all the way to pricking or nicking or otherwise cutting or slitting even the clitoral hood. In other words, not even the removal of tissue is happening in some of these cases. And these mild forms of female circumcision are happening, especially in places like Southeast Asia, where it's also medicalized, taking place in clinics. There's a wide variety. It gets more severe than that. Total removal of the clitoral hood, which is literally analogous to male circumcision. Clitoridectomy, the removal of the clitoris, the ablation of the labia, the infibulation, which is where many parts are removed and then the vagina is stitched up with a small hole for urine and menstrual blood to pass. I mean, that's obviously very bad. That only accounts for 10% of all female types of female genital mutilation.
All right. But they are analogous in some ways. That's what you're saying, the regular one is.
Yes, I mean, certainly clitoral hood removal is directly analogous. I imagine women would not like their clitorises scraping in their underwear all day, or having to use artificial lubrication, and perhaps sex would be rather strange for them. And that's basically the experience that the circumcised man is expected to experience.
All right, let me read the rest of these. We'll pull somebody else over. Shadley Jones said, "Turn off bloody baby BJs and go outside." Cloudstar says, "God admitted that foreskin was a bad idea. Comparing circumcision to female genital mutilation is an argument for retards." Spectre 6 Gaming said, "What do you call a cheap circumcision? A ripoff." Opinions Hurt says, "I don't know who this pro cutting guy is, but unless you have a kid, shut your fucking mouth." Sean B says, "I wonder who started circumcision," and that was in the echoes. Okay, let's pull somebody else. You said you got a couple people you want to pull over today.
Yeah.
All right, do it.
You're on the air.
Kalash, yes, you're on the air, sir.
All right, how you guys doing?
We're doing
What's up?
good.
You said you had one question.
Yeah, I really only have one question. Gregory, man, you're out here trying to hurt my bottom line, Goy. I don't know what you think you're doing, but without my export of the old kosher calamari, what am I supposed to do? I mean, I need the money. I need the shekels to feed my family, Goy.
Okay.
Got nothing on that one, do you?
I mean, I don't know. What are you trying to say? Are you a healthcare provider that performs circumcisions?
No, I'm in the export business. I need to get some of that dick flavored pepperoni from my Jewish pizzas. I'm out, guys. I'm sorry. I just had to get in there for this.
It's all good. Thank you, sir.
All right, not a serious person.
I believe he was pulling your leg there, Gregory. Yes.
Yeah, he was.
Oh, yes. No, it's fine. We take all comers.
Yes. I won't make the joke. Okay, bring somebody else in today.
Hey, you're on the air.
All right, cool. All right, so this has been pissing me off for like the last 10 minutes here.
Okay. Speak.
Let me collect myself.
Okay.
All right. Okay, so you're not circumcised, correct?
That is correct.
Okay. And you don't believe that there's any kind of medical reason for circumcision, correct?
No. I'm in line. No, I'm in line with the Nordic countries who are averse to using circumcision for basically anything.
Okay. So the problem is that I'm not exactly keen on criminalizing it, period. And here's why. My nephew is not circumcised. And he's got some issues where the skin is not pulling back from the head all the way. So his pediatrician, because this was his mother's decision, it is a decision. You do have the choice in the United States as to whether or not you want to circumcise. All right? And because of the issues where the skin's not properly pulling back, and now he's being taught how to clean it properly and all this and that stuff. Mm-hmm. And because it won't, the foreskin will not separate from the head correctly, there's a possibility in a few years, by the time he's 12, he's going to have to go through the procedure of having a circumcision.
Wait, how old is he now?
He's 6.
How long have they been trying to retract him?
Since he was a baby.
Okay. There's your problem. They have been trying to retract a non-retractable penis. In infancy, the penis, the foreskin of the penis is fused to the glands. There's actually two separate elements here. It's fused to the glands with a membrane called the synechia, which is it's histologically similar to the membrane that binds your fingernails to the nail bed. This dissolves somewhere in toddlerhood, but the preputial orifice, the opening of the foreskin, can still remain tight. Trying to force this back all the time since infancy causes all kinds of problems. It causes scarring and all kinds of problems, and it can cause phimosis. And, of course, doctors will then use that to sell circumcision.
They're waiting a few years and hoping that it actually corrects itself, because my sister does not want to go through this type of thing because she made the decision not to get a circumcision. And
the doctor told the parents when he was a baby to try to keep retracting him.
No, actually, she was just making sure that the pediatrician was making sure that my sister knew she had to clean.
You shouldn't. No, you don't. You should not be trying to forcibly retract a clean. Do you douche your daughter? Would you? Would any? No, I mean you don't. You don't force soap into the mucous membrane of your daughter's vagina.
Let me tell you how the genitalia of a woman works. The woman doesn't piss out of her vagina. She pisses out of the urethra, which is actually about an inch or so above the vagina opening.
Okay, I don't need an anatomy lesson, but yes.
Well, obviously you do, because you don't understand how this works. The penis has the urethra.
Okay, do you use aggressive soap on the mucous membranes of your daughter's vulva?
You don't use aggressive soap on babies, you dumbass.
Okay, well then don't be trying to. The first person to retract the foreskin should be the boy himself. Just leave him to his own devices. If they've been forcibly retracting him since infancy, it may well be that he has a bunch of problems now. But at the same time, in accordance with medical ethics, according to the principles of non-harm and proportionality of treatment, there are less invasive treatments for this, and they include steroid creams, they include manual stretching of the tissue expansion, and at absolute worst, there's something called preputioplasty, where an axial slit is made in the top surface of the foreskin, and it's sewed together circumferentially. And this is essentially, depending on how big the cut is, it's a guaranteed fix. But at the same time, studies in Holland, the average age of retraction of the foreskin is 10 years old. This is not even phimosis is undiagnosable in children.
All right, this is a super chat.
So I'm going to trust the pediatrician that's got 30 years of experience.
Oh, you're going to trust. Hold on. You're going to trust the American doctors who tried to re-legalize female circumcision in 2010. That's who you're going to trust. Oh,
that's
yes,
the
they did.
Doctors that were doing it.
No, honey.
In Michigan.
In 2010, Douglas Deakema, writing on behalf of the American Academy of Pediatrics, was advocating the legalization of type 1A FGM.
You know they're doing it in Michigan right now.
Yes, the Dawoodi Bohra sect. By the way, that was being done by doctors. 2 doctors at a Detroit emergency room.
Yeah, 2 Muslim women.
Nice and under clinical conditions with pain control and antiseptic practices. It was clean. It was hygienic.
It's still horrible, because you know what the clit is for?
Do you know what the foreskin is for?
The clit is for sexual stimulation, too.
The foreskin is for sexual stimulation.
You can still get sexual stimulation without the foreskin.
You can get sexual stimulation without the clitoris.
No, you can't.
Yes, you can. Women do not need a clitoris to orgasm. There are studies that have been done in Africa.
The entire point.
There have been studies that have done. You do not.
Is so that the woman is a mattress.
The entire point of removing the foreskin is to destroy male sexual pleasure as well. That's how it started in this country.
That's not actually how it started.
That actually is true. That actually is true. John Harvey Kellogg in the late 1800s was promoting it as part of a moral hygiene campaign, not physical hygiene, moral hygiene. They had an obsession with morals and disease, and they thought that was
because that guy was fucking nuts.
But and William Sayre, the founder of the American Medical Association, was right there with him. Those are the people that started it. It started as a deliberate effort to harm male sexuality. Everything else is a post hoc rationalization. Everything else. Look, I'm sorry. I don't mean to blow up on you. I mean, I feel for your nephew here. I want the best for him, and the best for him is for the doctors and the parents to stop meddling with his penis and just leave him alone.
Gregory, would you outlaw circumcision in all cases, or still leave it for medically necessary cases?
No, yes, of course. There may be medical cases that require. The problem is, especially in a place like America, if you leave it and just say, "Oh, you have carte blanche to claim a medical need for it," in a place like America, it means the doctors are still going to be enthusiastically doing it. If we're going to leave it like that, then we need it to be so rare and so stringently regulated that it has to go up before a national board, before Congress, to get approved before it actually happens.
All right, Twisted Puppet, you got anything else?
I don't think the government should be regulating a boy's penis any more than I think the government should be regulating a woman's vagina. So,
okay, legalize female circumcision then.
Well, that's still fucking regulating a woman's vagina, dumbass.
You just said you didn't like it.
You're fucking stupid.
You don't. So legalize female circumcision.
So stop strawmanning.
What conclusion?
For one, stop strawmanning.
What conclusion am I to draw?
Stop strawmanning. Stop fucking strawmanning
here.
You know
what's
what
the straw man, ma'am?
is because you've been doing
No,
it.
what is it? You tell me.
Minutes, you fucking moron. You've been twisting everybody's fucking words around to stonewall any fucking argument.
I throw out the truth, and if you're stumbling over it, that's your own problem.
Possible. I'm not stumbling over anything. You've been talking fucking retard for fucking 30 goddamn minutes, and I'm fucking sick of it.
Well, I've got you steamed up, haven't I? Look, I want the best.
Steamed up because I'm talking to a fucking moron.
I want the best. I want the best for your nephew.
I want more than the best for my fucking nephew, and the best for my nephew is for your ass to fucking anti-hero.
Well, what does that? What do you mean? Do you believe that the best for your nephew is to run out and get circumcised, or do you think his whole body should be? Do you think the health of his whole body should be preserved?
Can you take a moment to listen back to yourself? Because that's an example of straw manning. Now shut the fuck up.
Please pass this information on to your sister and your nephew. I wish the best for them. Circumcision is not required. Phimosis is not even diagnosable yet in his case.
All right.
Pretty sure it is.
Thank you, Twisted Puppet, for joining us. Okay.
All right. Thanks.
Thanks.
Wow. Okay, that was good.
Holy shit. That was amazing.
Let me read a couple of super chats. Shadley Jones said, "Stop laughing, milady. I'm a razor rape survivor. Opinions hurt." Says, "Holy fuck, this girl is dumb. The foreskin doesn't separate until pre-puberty. Am I the only one with a child here?" Rosoriel said,
"Yeah."
Rosoriel said, "Pediatrician's name, Shlomo Mordecai Sheckelberg."
Here we go.
Ghost of Mr. Problematic said, "The 12-year-old doesn't know about the G-spot." Isaac Frost said, "Come home from work, click on stream thinking the title was a joke. Internet Bloodsports 2.0? ? Yeah, we're taking to the next level here tonight." JFMD says, "Pediatrics resident here. Greg is saying a couple crazy things that I can't get behind, but I also disagree with routine circumcision." By the way, if you'd like to get on, it would be pretty cool if we could get like a doctor or a doctor in training on. That'd be awesome. That'd be pretty cool. So we would move you to the front of the line, sir, if you would like to get on. Then again, I understand why you might not want to, but it would be cool if you did. Anyway, Adolf Hogg said, "Best show ever. This dude is obsessed with the schlong. Goddamn drawbacks." Oh wait, I think we just got another super chat from the resident while I was reading. He said, "Routine circumcision is neither ethical nor medically justifiable. The NNT for routine circumcision is 110, so 110 healthy foreskins to prevent 1 UTI. Greg is wrong. Phimosis is diagnosed, but often not an issue." So that was the doctor chiming in there.
It's physiological phimosis. It's not. I mean, it's a natural
he's agreeing with you on a lot of what you're saying.
Yeah.
Some of your talking points, I think he just doesn't. But I mean, I have to consider that a win for you. Okay. Who else? Let's see. Who else do we got? Who's been in here the longest? Let's try Jack Atlas. You're on the air and you're muted. So.
Yeah. Can you hear me now?
Yes, I can.
Yeah, hi. So, thanks for having me on. I just wanted to say a couple things about Twisted Puppet and SoCal Chris.
Yes.
Yeah, they should both swallow a fucking shotgun. That was a joke. in terms of straw manning for Twisted Puppet, I mean, she didn't know what's his name, Gregory. She didn't know what Gregory's position even is. Gregory obviously never said all, hashtag not all. So obviously, Gregory, am I right in understanding that you're happy for medical emergencies and stuff like that?
Yes, I'm. It wouldn't be a categorical ban. My only problem, especially in a place like the United States that has an existing culture that is obsessed with circumcision, would be that leaving a wide open loophole for, quote, medical necessity.
Yeah. All right. So in that sense, she was fucking strawmanning you, right? Because she was accusing you of trying to. She used anecdotal evidence. She said, "Oh, my fucking nephew," and then she said, "Oh, you're trying to prevent me giving him some sort of a medical assistance." This is. I think it would have been helpful if at the start maybe your kind of whole agenda was more clearly outlined, what you really want to achieve. And that's actually one question I have for you. Like, in terms of your end game, what do you think you can realistically achieve? Because you see with the kind of reaction that a couple of people are getting, like SoCal Chris, he was like, "Oh, why are you focusing on just little kids' dicks? Focus on something else." I really sympathise with what you've committed yourself to. I think genital mutilation of children is fucking abhorrent, and if people ever can visualise that shit, they should hopefully understand why it's a very worthy cause. But do you really think you're going to achieve anything? I mean, I know people in this community, people like to talk about the JQ, right? Don't you think that at some point you're going to hit a wall where people are going to be saying, "Hold on, you're attacking circumcision. That's a central tenet of our faith," or something to that effect. You're fucking anti-Semitic. Do you think you're going to hit that wall? Do you think you're going to be able to realistically legislate for any of this?
This is a very good question. I hate to be a shameless promoter. I have a YouTube channel where I talk about a lot of what my plans are, and I'm actually shooting a channel trailer which will do a better job of explaining my big picture goals. Yes, my big picture goals I mentioned before are a circumcision ban, punishment for the perpetrators, and government funding for tissue regeneration initiatives to make the living victims of genital mutilation whole again. There are ways that I plan to do that involve various protest strategies targeting mostly the parents, because the parents are the soft underbelly of this entire thing. The medical field is virtually impervious to criticism by virtue of authority appeal. And they're actually...
Well, I mean, I'm less worried about the medical views, because more and more medical personnel are coming out in force and saying that there's just no reason to circumcise. But I'm more worried about the court of public opinion, because when you've got a country that has huge proportions of people who are circumcised, I think it was what you mentioned. Oh, mummy wants son to be like daddy. And they've got this hammered into their minds. I mean, how are you going to? Plus, you've got the social justice aspect. You're attacking something that's associated with, and I feel like there's going to be plenty of people who are going to try and associate what you're doing as an attack on Jews themselves. And how are you going to defend against that?
Right. Well, in the case of America, I actually think it's perhaps the opposite. I think the large circumcised population here actually makes the country something akin to an ocean of spilled gasoline and a mountain of gunpowder on this issue. I see nothing but opportunity when I look out across this hellscape. But in regard to the Jewish involvement in the matter. I mean, I have to say there are prominent Jewish intactivists. There are many of them. Paul Fleiss.
And there are also prominent and there are prominent female anti-feminists, but they don't fucking help, So, well, I mean, greatest credit, my greatest respect to what you're doing, but I'm just sadly skeptical that it's going to.
Well, no, I'm interested in what you have to say. Are you saying that it may be more useful to attack the Jewish angle?
No. I mean, I don't really know. It's not something that I've figured out myself. It's an issue that I've been thinking about every now and then. It does really get under my skin. There aren't many things that kind of quote unquote trigger me. This is fucking one of them. And when SoCal Chris said like, oh, why do you care about this? There are so many other important issues. I feel like people aren't appreciating the central fucking driver behind all of this, which is just that this is such a strong, principled thing, and maybe people who have been circumcised, maybe they can't appreciate that, they can't put themselves in the shoes of having that choice again. This isn't a question of whether someone likes it. This isn't even a question of whether it's medically necessary. It's just a point of fucking principle and consent and integrity. And the idea of violating a child, or be pro-circumcision, great, but
all right,
allow it at an age where, all right.
Yeah, I'm gonna have to cut you off because we have a pediatric resident we're about to drag on.
Oh yeah, please, yeah. All right,
but,
thanks, man.
I want to thank you for coming on, man.
Oh,
Yeah,
yes,
thanks.
thank you. Yeah, yes, male consent matters. The human right to physical integrity matters. That is the central issue of this. I hate talking about sexual utilitarian arguments all day. It's just people love listening to the train wreck of that.
Let me read these. Speaking of a couple of those, somebody says, check out Bake Stream. It's a mess. We'll check back in before we get off. JFMD said, I'm Broba Fett in the Discord. That's the doctor we're about to drag on. Adolf Hogg said, vote yes on Smegma. Make foreskin great again. Hypocrite said, Greg is terrified of the look of disappointment on his future partner's face when he loses his virginity. It keeps him up at night and it drives him.
No, the genital mutilation of infant boys keeps me up at night.
All right, let's bring in the good doctor. Hello, sir. You're on live on the kill stream.
How you doing?
I'm doing pretty good, man. This has turned out to be a lot more interesting than even I thought. So
yeah, same.
I'm way past my bedtime. So for reference, I'm a second-year pediatrics resident at a quaternary care center, and circumcision isn't really something that I deal with a ton. Every pediatrics resident has to do newborn nursery rotations where they'll have an opportunity to perform circumcisions or at least watch a circumcision. You don't actually have to perform one to meet your residency requirements, but I think while Greg's approach isn't, I completely agree with his ethics and his message. I think that circumcision, I think we take for granted and we use really bad data in the medical community. And this is coming from someone who is in the medical community. We use bad data to justify the practice. So a lot of things you'll hear are it prevents urinary tract infections, and it actually does. The relative risk of urinary tract infections for a circumcised male is 8 times less than an uncircumcised male, which sounds scary, right? You tell a parent that and they're like, well, I don't want my kid to have a UTI. It's especially something, with such a degree of risk. But then when you look at the prevalence or how often males get UTIs, of what the number needed to treat is. So how many foreskins do you need to take off to prevent one UTI? And I mentioned this in the super chat. It's 110. That's a lot of foreskins removed to prevent one benign condition. Now, UTIs can be dangerous, but with modern antibiotics, even really basic first-line antibiotics, I have a easy time treating UTIs. And I actually I work in critical care primarily. So I take care of kids who are sick with like urosepsis, whose UTI has gotten into their bloodstream. They get really sick. And I can tell you those situations are extremely rare, and I'm not necessarily certain that a circumcision would have made a difference. Children have an inherent right to bodily autonomy. And it is a question of medical ethics as well, and medical, maybe not necessity, but risk versus benefit. So anytime I do something to a child, like for instance, if I call a surgeon to take out a child's appendix, that's not a benign, really, it's an invasive process. It's traumatic to their body. So I have to justify that with the risk of what would happen if I leave an appendix that's inflamed with appendicitis in their body, they would probably die. So we can justify the terrible things we do if, to people, if there's some sort of greater benefit to doing that.
So you pretty much agree with Gregory then?
Really, honestly, the newer generation of physicians, it's to help Greg to understand kind of where doctors are coming from. Trained, it's really hierarchical. So we're sort of taught to take our instructors' teachings face value and to really trust what they say has some scientific veracity. But that's not always the case, and a lot of times we rely on our training unless we find that we really want to question a part of our teaching. I don't know why I got really interested in circumcision, because I'll never perform. I'm going again into trauma and critical care, so there's no role in which I'll ever or need for me to do that.
Right.
But I still was interested in it because I think we pitch it to these parents when we go to, they have the newborn baby, and we say, before they're going to be discharged home, if they have a boy. So home, we'd like to offer you a circumcision. And I think it's kind of rooted in religion. It's rooted in the fact that most males in the United States are circumcised. So we take it for granted like it's a routine thing. And then it's kind of justified by really pretty shitty evidence that I already talked about. And so I guess what I'm trying to say is I don't think there's some conspiracy where doctors are trying to hurt these children. I think a lot of doctors think they're helping a child by circumcising them, but it will take some time for better evidence to really disseminate. And it will take, I think, unfortunately, it'll take doctors who are interested in it. And so, doctors like me who are part of their medical societies to try to bring policy changes so that our policies change. So our clinical practice guidelines on routine neonatal it's already changed. It used to be recommended, and now it's not.
So it's changing now then.
Well, of course, who changed this? What task force statements are you citing?
So the AAP guidelines on routine neonatal circumcision changed, I think, in 1998 from being universally recommended to basically saying they don't really recommend for or against it. They think the guidelines essentially say it should be a discussion between patients and their physician. And so what it ends up being, good question. So in everything in pediatrics, we use parents as a proxy decision maker for a patient.
They are the patient, even in non-therapeutic cosmetic surgeries.
Don't get me wrong. I'm not going to disagree with you that the infant is the patient.
I'm interested in this. Is it considered that the parents are the patient, even in the case of non-therapeutic and cosmetic procedures?
It's always the patient, but medical decision making is done by the parent until they have the capacity to make a decision. So until they reach autonomy.
Are there any restrictions on the use of proxy consent? Is it acceptable to be using proxy consent for non-therapeutic and cosmetic surgeries?
I think in general,
I'm not trying to bait you. I'm actually asking, what did they teach you in medical ethics class?
I think in general we would say that you could really only justify a procedure if it had some medical benefit to the child. So in that sense, cosmetic procedures would not be justified. A parent, for instance, couldn't say, "Hey, I want my kid to have a nose job." I don't think any plastic surgeon in their right. In fact, it's any plastic surgeon who did perform the procedure would probably lose their license to practice medicine. But Greg will make the argument that circumcisions are medically justifiable based on, again, I think, inadequate evidence.
Do claims of medical benefits for female circumcision play a role here? Where is the physical integrity principle for the preservation of the whole body? I mean, I can't really tell what's going on here. Are doctors behaving inappropriately? Is the underlying medical ethics teaching screwed up?
The medical ethics is off. I just think that the evidence that we use to justify circumcision is poor, and the better evidence that I think shows that circumcision doesn't have medical justification has yet to really disseminate through the pediatric community. Does that answer your question?
This is, I suppose, but my contention is that no amount of evidence would ever make this okay. In the same way that no amount of evidence would ever make female circumcision acceptable, and such evidence actually exists.
Greg, okay, go ahead.
There was a sit-down session with the members of the American Academy of Pediatric Circumcision Task Force in which they were forced to admit that it is not true that there are no claimed medical benefits for female circumcision, and put them in a very awkward position.
I'm rather ill-equipped to debate female circumcision, and so I can't really justify female circumcision. I'm frankly not aware of any medical benefits for it. What I will say, though, is that when it comes to male circumcision, there are data to suggest that circumcision may provide certain medical benefits. Again, I don't think those benefits are justified when you look at the greater picture or the better data. Does that make sense? So let me give you a better example. You would say there are no medical benefits that would justify circumcision. Well, I do a lot worse. I could do maybe terrible procedures in an effort to save a child's life. So, I had a kid.
This is non-therapeutic in its nature. The routine infant circumcision, by definition, is not being done for any specific therapeutic purpose. This is another thing that I don't understand, which is that it basically predisposes that the escalation curve, the proportionality of treatment curve for a preventative act is actually more radical than it would be for a therapeutic act.
Well, no, I would agree with you there. Yes, treating a UTI is far less traumatic to the child's body than the circumcision itself. I totally agree with you.
Yeah, if you were in a hospital and you said this child has a UTI, I'm going to circumcise them because of that. I mean, I don't know, but I think that would cause more problems than saying I'm going to circumcise because of claimed X, Y, and Z preventative medical benefits. Decades
I think the doctor agrees with you.
There's no disagreement.
Yeah.
Yeah.
I'm pretty much agreeing with you. But what I'm trying to say, Greg, is it's going to take some time for people to realize that the benefits. So, I mean, an easy example is the main medical justification for circumcision. The number one is urinary tract infection prevention. That's it. We agree.
Yeah,
but then the second one is our STI studies out of essentially sub-Saharan Africa that show, yes, people who have routine circumcision have a lower likelihood of contracting certain sexually transmitted infections. And we could get into like the appraisal of that literature. I don't think it's helping anybody because in either case, I think you and I would agree that if we're genuinely interested in preventing STIs, then we should be encouraging things like safe sex. People would say abstinence as well. I'm not going to get on that political sphere, but still. Does that make sense?
99%
I think it makes sense. By the way, thank you for joining us, man. I really do appreciate that we were able to
really enjoy the show, Ralph. Take care.
Can I say one thing? Can I say one thing?
Sure, Gregory.
Well, is he still here?
He's still here.
Yeah, I'm still here.
I urge you to make this information known to your colleagues on the pediatrics floor, because in general there seems to be a very compartmentalized attitude on the parts of doctors. They're very willing to say, "Oh, well, it's really not justified." But I have to say, on this issue, silence truly is violence. And I have to also say to the perpetrators, every circumcision you've signed off on is recorded in medical records, and those can be subpoenaed.
All right. Thank you. By the way, thank you for that comment. I'm glad you enjoy the show, man. That means a lot.
Yeah.
Here, guys.
Awesome.
All right. Very well. All right, Gregory, stop threatening the doctors on the show. Are you crazy? Oh my God, he was agreeing with you, man.
Yeah,
I know, and I understand that. But there is a severely compartmentalized attitude that I come across in doctors.
He hasn't even done any circumcision himself.
I know that. I know that. But I try to get the information out there. I try to rattle people's cages to get the information out there. And
I'm just saying that's an ally. That's an ally of yours, and you're kind of like freaking him out, I think. But all right, fair enough. We got one more. I know people are begging me to go to the bake stream. I think we're having a pretty good discussion here. I will tune in shortly. There's some bitch tied up in a fucking straitjacket. It is a little strange, but I got one more guest, and I'll bring some more in after. But we'll do one more guest, and we'll check in on that, and then we'll bring some more in, and then we'll probably sign off after that. But okay, this person actually tweeted at me. Okay, you're on the air live on the kill stream.
Yep.
Oh wow.
And there he goes.
They tweeted at me, man. I'm pathetic.
We'll try one more time.
I'll drag him back in. Oh. Hello.
Hey, can you hear me?
Yes, I can. You're live on
All
the
right.
stream. Okay.
Hi.
Hi.
How are y'all doing?
Doing good.
Pretty
How
good.
are you doing?
Sorry, I'm going outside so I can. What the fuck was that?
Okay, say what you gotta say. You're outside?
What was that?
What was what?
Are you talking about the pediatric doctor that was just in here?
Or me laughing to saying you have to go outside? Yeah, you were going outside. Okay. Is it gonna get really loud? Is that why you have to go outside?
No.
Okay.
No,
Let's
I
keep it pithy.
feel like, no, I
ahead.
have a little boy.
Okay, go ahead.
So I have congenital birth defect. I'm missing half of my left arm. And when my little boy was born, I had a big issue with cleaning him. And it was advised by his pediatrician to circumcise him. And I was kind of pressured by my family. And I couldn't clean him properly. And I don't like circumcision at all. But I wanted Gregory's point of view with that, because it's a really rare situation. Because if I didn't have to, I wouldn't.
The idea that your son should be surgically altered because of your own health problems is so crazy. I don't even know where to begin.
But it's not a health.
Beyond that, I don't know what this means. Cleaning for the first couple years of life, the foreskin is not retractable at all.
Are you kidding?
Were you forcibly retracting it? Were the doctors forcibly retracting it? It's certainly not retractable at birth.
He had feces under his foreskin.
Okay, so clean it out and let it go. Girls get feces in their vulvas. Do you cut out parts of their vulva?
I have one hand. I couldn't.
Am I being trolled?
Shit. No. Are you kidding?
The idea that your son should have his genitals mutilated because you're missing a hand is ridiculous. Were the doctors actually indulging this line of thinking?
Oh, wow. Okay.
Do you think it's acceptable to cut off part of your son's penis because you have a health problem?
I don't have a health problem. This is a genuine question. Jesus, Greg.
Sorry, I shouldn't be laughing.
Greg, take it down a notch. Oh my god. All right. So you gonna answer the question, or
I don't know. Is this real?
Yeah. It seems
yes.
like it.
I think she's real. Yeah.
I think it's insane. I think it's insane. I don't know what to say.
Okay.
Thank you for coming on.
Thank you, Ralph.
You're welcome. Damn it, Greg.
And we have made a woman.
What on earth am I supposed to? They cut off part of a baby's penis because the mother didn't have a hand?
God, dude, you could have been a little nicer, though.
It's not her. Jeez.
She didn't want to do it.
Well, then she shouldn't have done it. There's nothing.
She can't stop anybody. She only has one hand.
There are people all over the world with one hand. Within my own family, there are people that had their hand injured in an industrial accident. The idea that should have an impact. Would it have been any better to cut off part of her daughter's vagina because there was poop on the edge of her vagina? That is the litmus test. Would it have been acceptable then?
I'm just saying, man.
This is Ralph, this is the circumcision psychosis that the United States of America is in the midst of. The idea that this is even remotely acceptable. The idea that these fucking doctors actually indulge this line of thinking. If this is real, and I mean, I have been trolled 8 ways to Sunday on all sorts of aspects of this issue.
I mean, she seemed pretty legit. Somebody said, fuck you, Ralph. Be nice, be a man. I'm just saying. Maybe a little nicer. I know my slogan is fuck being nice, so I guess I can't really say anything, but... all right, a couple of super chats. Shadowley Jones, the feeling when red pill overdose leads to baby cock obsession. Ivanov... Oh, fuck, I always fuck this one up. Ivan Vakanov? I don't know. Do you think the prevalence of circumcision is evidence enough to say that the Jews run America? How do we stop the Jews? Race war now? Question mark. What do you say to that?
Well, I believe 5 of the 8 members of the American Academy of Pediatric Task Force in 2012 were in fact Jewish, including a man by the name of Andrew Friedman, who bragged in a medical publication that he circumcised his infant son on the kitchen table of his father on the 8th day of life, that he has 4,000 years of tradition staring over his shoulder. Another person on that task force was Susan Blank, who was a Jewish woman who was the health commissioner of New York and permitted a herpes epidemic to rage out of control from this mestitza b'peh, oral sex circumcision ritual that the Orthodox engage in.
Disgusting.
And this, this killed several boys of herpes encephalitis and meningitis, and she let this rage out of control. And I think it should be noted that there's not a lot of criticism from the Jewish community in regards to this. It's very disturbing how the ranks close whenever there's any criticism of circumcision. I mean, Andrew Friedman is an Orthodox Jew or conservative, some kind of adherent Jew, I believe. Susan Blank is an LGBT left-wing Jewess, and yet when it comes to circumcision, you couldn't fit a paper between them.
All right, a couple more. There's videos of people painting masterpieces with their feet, and this chick can't clean a baby wiener with one hand. The ghost of Mr. Problematic said that. Yeah, I mean, I'm not saying I agreed with it. I'm just saying maybe a little nicer. Anyway, you're right. Fuck it. Just say whatever you want. El Chango,
I guess.
Just say whatever you want. We're glad to have you on. This has been a real Bloodsports night, I think. El Chango said, "Holy shit, this has been a great night so far." It really has been. Let's drag on. Let's see. Let's see, who do we got? Let's see. All right, you're on the air live on the Kill Stream with Gregory Malchuk, anti-circumcision activist. How you doing, Rexford?
Hey, how are you guys doing?
Pretty good, man. You got something to say to Gregory?
Yeah, Greg, I'd just like to... may I call you Greg?
Yeah, certainly.
Yeah, I'd just like to ask you, so circumcision does reduce feeling in the penis, correct?
Yes.
Wouldn't that be a good thing, then?
I mean, I prefer to feel the sexual act. I don't know about you.
Well, there's so much sexual degeneracy that goes on in the world right now. Don't you think it'd be better if people had less sexual urges?
That's very interesting. That's a very Talmudic approach. The Jewish scholars in the Talmud. Well, they take a very similar position. It's interesting. There's a study by Lauman et al., which studies the sexual behaviors of intact and circumcised men, circumcised men have more lifetime sexual partners. They engage in more degenerate sexual behaviors and paraphilias. They have interesting obsessions with certain kinds of sex. I believe they picked up a proclivity toward oral sex, specifically oral sex in circumcised men. So if we're talking about deviant sexual behaviors, ending circumcision would seem to be a better way of going about it.
But in all the places where circumcision is extremely prevalent, wouldn't you agree in calling these places, the majority of the population is populated by cucks?
I don't really.
Such as in Western Europe. The majority of the population is a bunch of low-T soy boys.
Okay, well, Nazi Germany was intact. I don't know what you want me to say.
No one brought up anything about that. That's very offensive. My great-grandfather.
Are you in line with the Talmudic approach, Rexford?
Oh, extremely. Right. No, I just think that circumcision... So basically, there's too much sexual degeneracy going on in all the places where they don't practice circumcision, such as Western Europe. They're super just disgusting. They have those just disgusting displays where they think art is just people having sex in the streets. It's very offensive to my eyeballs.
Yes,
and
well,
so
our people, the European people are truly a very sensuous people indeed. I don't find classical or Renaissance art to be disturbing in that respect.
I do.
All right,
go to hell.
I think circumcision should be mandatory.
If you can't, okay, that's great. If you can't appreciate the art of classical civilizations and the Renaissance, and I don't even know how you can call yourself
art is made up. There's no such thing as art. It's just BS that people put random splotches on canvases.
All right, Rexford, thank you for joining us, man.
All right, I love you.
A certain circumcised bunch of people, a certain circumcised group really kicked off the trend of modern art, if that's what you're getting at.
I see. Will you say that they were in line with a Talmudic approach?
Pardon?
Would you say they were in line with a Talmudic approach?
Who was?
The people who kicked off. No, the people who kicked
off.
Oh. Well, yes. I suppose you could.
I just love that line of yours. I'm going to use this as often as I can. JDK said, in half an hour, Greg has gone from creepy foreskin guy to best human. That's from the chat. That's from the regular chat. I do
it
read
means
the
a lot.
I do read the regular chat, too, for the record. Opinions Hurt in the super chat said, I feel a bit bad for Lady with the Stump, but she's a weak person. I feel Greg's assessment was spot on. Robert Chalk said, just came from the Christian Mingle stream. LA needs to be glassed. No argument there. Okay.
Christian Mingle.
Let's see, who else do we got? I see Band is in the green room too. We'll drag her in soon. Let's get a couple others. There's been some people on here for a while. All right, let's try this one. You're on the air live on the kill stream. And if you're muted, we're going to kick you back out. And you are. So,
Hey, wait a second.
All right.
I'm live right now, motherfucker. I've been waiting for 2 hours. But I'm glad to see. that Bloodsport is indeed back on the track. I like it.
Bloodsports are back on the menu, boys.
We're here for the people.
Okay.
Yes, I do like to think we're covering some real content here. I think that's
we are.
Yeah.
It's different opinions. This is how you do it.
Yes, I have one issue with that guy in particular. I heard government funding for regrowing skin back. We already $20 in fucking debt. And you don't have your penis circumcised personally, so you don't have any skin in the game?
Yes, well, again, I don't consider this optional. I am going to keep fighting until such a time as my fellow men can be made whole. And this is not about me. I think
I know you're ideological. I am too, okay? I'm a man of principle, you're a man of principle, okay? My principle is I'm tired to found everybody else shit, okay? What's next? You're gonna tell me,
you know,
I'm not a hole if I don't have any of my hair.
You're part of the society. You're part of the society that has failed to protect children from genital mutilation. I think everybody's going to have to do their part. I'm not Mr. ANCAP here, and I'm not going to sit here and say, "Oh, the government is evil. I don't want to fund anything."
I've catched that already.
I'm tired
of being surrounded by leech.
We are spending.
I'm tired to be surrounded by leech, like you motherfuckers that always want to find a cause.
Yes. We're spending $1 billion to develop a hypersonic cruise missile that would only ever be used in the event of a global thermonuclear war. We spend $1.5 and $2.5 billion a year in order to genitally mutilate infant boys.
Okay. So
we are settled with the idea of spending enormous amounts of money on ridiculous and irrelevant things. Making men whole and investing in tissue regeneration, which will yield dividends far beyond just genital integrity,
you got numbers.
Would be a boon to our civilization. Would result in
principle.
In great advances in organ regeneration, and could even the developments would ultimately lead to what we're bordering on, which is biological immortality.
My point is, I'm a man of principle, okay? I'm not gonna found the fucking tranny fun to have their sex change. I'm not gonna found the fucking bald-head guy.
You are going to fund the effort to make men whole again who are raped at birth.
Why?
Because Because if you don't, I'm gonna sick the IRS on you, and there's gonna be an FBI agent crashing through your back door in the middle of the night. That's
Look, I can meet you halfway. I'm agreeing with you with the body integrity thing. So
okay.
I'm disagreeing with you in your human rights part when you're going on the Ulsterade and you want everything to be taken up by daddy government. So go fuck yourself, motherfucker.
So are you opposed to private initiatives?
No, I'm not opposed to private initiatives.
Okay, the problem is, though, the society itself condoned and promoted and actively...
Don't you see it?
I don't care. One case is enough to see it in this light, but in the reality, it's about 1.1 million a year.
You don't care if your lot of bread costs $100 at some point. You want to be Venezuela 2.0, eh?
Could we, again, we're spending $1 billion. Trump spent $250 million, I believe, on the hardware alone for the missile strike in Syria. Could we put that toward tissue regeneration?
No.
Can we spare any money for genitally mutilated men?
Military is the only thing I would found.
We spend millions of dollars to reverse female circumcision of people who were circumcised in societies that are not even our own, who we played no part of in their genital mutilation. And we can't give something to our own genitally mutilated men. It's just insane.
All right, Ghost of Caligula, thank you for joining us, sir.
No problem.
All right.
Woo lads. It's getting spicy in here.
I don't know if that guy was foreign, but I have to say, any intact man,
Gregory, that's a safe bet.
Any intact man that counter signals the idea of a circumcision ban. Some actually do. But even to the level of counter-signaling the idea of making men whole again, I believe should immediately go out and get circumcised, because what they're saying is that in principle, they would not have been protected, and they're okay with the idea of there being genitally mutilated men who are simply out there in the ether without recourse. They're okay with that. They should go out and get circumcised. They should put their money where their mouth is. They should put their money where their foreskin is.
All right, let's try a few more.
You could say they should put their skin in the game. Huh?
Put some skin in the game. You could definitely say that. Okay. Let's try OTV. OTV, you're on the air live on the kill stream. Hopefully you'll...
Oh, hey.
Yeah, what's up?
I just wanted to ask, so are all the medical professionals and the AAP wrong, or is this just like some, because I'm not really getting where you're coming from. Is this like a Jewish conspiracy? Are Jews trying to force men not to get pleasure from sex? I don't really understand the narrative.
There exists as a hallmark of this entire thing an enormous amount of inertia. This existed in a previous time, and therefore we have to keep doing it. On the parent end, on the ends of the parents, it can mean absolutely anything. On the ends of the doctors, it means maintaining the legitimacy or at least permissibility of circumcision long past the time humanity has sort of come into its own in regarding human rights and medical ethics. In a way, the doctor that was on just a few moments ago was essentially right. Perhaps there isn't one big covert conspiracy to genitally mutilate men. You can certainly have the effects of a conspiracy without there being one. But I mean, I don't know. Do these people gathering at the American Academy of Pediatrics to maintain the permissibility and legality of infant circumcision, does that count as a, quote, conspiracy?
I mean, do you believe that they're making these things up? Your chances of being reduced to STIs and HIV, all of that, do you think that's bullshit or what? I just don't really get the logic of, like, because, the doctor, again, was right in this regard. It is the selective and dishonest use of study data. How is it dishonest?
The idea that we're supposed to have a quote evidence-based unquote policy of male circumcision, but a human rights policy against female circumcision is in and of itself a logical fallacy. It's the fallacy of special pleading. There is evidence to suggest that female circumcision reduces HIV transmission in circumcised women by about 50%, which is about what is claimed for men. Why is this not being taken into account? Why are the medical bodies of the West not getting excited about this?
Well, I mean, are you more likely to contract bacterial infections from having a clitoris as well? I'm just,
you can certainly. I'm sure there's study data to suggest that female circumcision reduces infections of the vulva or the clitoris. I mean, you can find anything you want. This is much more fundamental than that, though. This gets to basic notions of the human right to physical integrity, to the fact that male consent matters, to the non-harm principle of medical ethics, to the physical integrity principle of medical ethics,
Gregory,
proportionality.
Let me throw this comment from Toad McKinley at you. He says, "Old men sucking the blood out of mutilated baby cocks is simply God's will." Goy, what do you say to that?
Yes. Yeah, I mean, I don't know if we gave this a very good introduction. There's this thing that certain sects of the Orthodox Jews do called mestiza b'peh, which literally translates to oral suction, where they mutilate the genitals of the infant. And these people, they are so powerful in our society that they not only manage to suspend any notions regarding genital mutilation, but they literally have managed to suspend the child sex crimes laws themselves long enough to suck on the mutilated, partially amputated penis of an infant boy. They suck on it, and they suck on it, and they give because about 3/4 of the adult population is chronically infected with herpes at any given time. They end up transmitting it through the open wound, and it gets into them, and they end up getting herpes encephalitis and meningitis, and they end up dying. And several of them died in New York in an outbreak several years ago. The woman there, Susan Blank, was on the task force.
Well, I was just wondering. First off, Ralph, you need to get Halsey in here.
Where is Halsey? Oh, wow, that'd be great.
By the way, I believe in Israeli slang, the slang term for a blowjob is mestiza.
That's
is
odd.
that serious?
That's very odd.
Oh,
yeah.
You know what? That's a good point. We need you versus Halsey. We might try to set that up. I mean, because you've been pretty much like mowing through people tonight.
Well, when he brought up Mestiza, I was just like, well, I remember actually, like, the reason as to why I even know about that is because I think he was fucking brought up to Halsey. Like, somebody had him ask it, a super chat, asked him about it, and he, like, elaborated about it and shit.
Oh, did he have some excuses for that practice, or
No. He said that apparently it doesn't go on anymore, or if it does, it's in like extremely radical.
Lie.
Can you goes on in radical sects apparently? But he said, like, I don't know much about like any of this shit.
Can you imagine? Can you imagine if the Catholics said, well, molestation that only goes on in the extreme Catholics. That's not us. That's not a problem. And it certainly does go on. I mean, this continues to this
Hulk
day.
Smash in chat said Halsey's busy with the penis sucking. I don't know if there's
he's sucking baby dicks right now.
I mean, that's what chat said. I had nothing to do with that. OTV, thank you for joining us, sir.
Yeah, man, of course.
All right.
Thank you.
Okay, so we got a couple super chats. Adolf Hogg said, anti-Semite soy boy that loves the dingus. Then Adolf Hogg said, this argument is like the Pitbull argument. It's not going to go anywhere. People are still going to own/do it. There is your logic. He's saying it doesn't matter what you do. They're still going to circumcise babies.
Again, my entire plan for this, and this is a departure from anti-circumcision activism to date, is to attack the parent-child interface. I want to be protesting circumcision. We show up with a megaphone and a sign outside of a school during drop-off or pickup, outside of a church when mass lets out, outside of a boys' sports game in a public park. And you get on that megaphone and you start screaming, infant circumcision is child rape. Infant circumcision is child rape. Hey, kids, are you circumcised? Ask your parents what the word circumcision is. Did your parents cut off part of your penis as a baby? That brown ring around your penis, that's a scar where they cut off part of your penis as a baby. Go ask them about it. Now, you do that for about 5 minutes.
You might get a charge doing that, though, Greg.
Yeah, well, look, protesting in public places.
That sort of tactic.
I get it. There's a very well-defined First Amendment history going back toward protests at schools. It's very well protected. But anyway, this is the...
Yeah, but I don't know. I'm just saying you're talking about dicks and stuff to kids.
I get it. This is like a 5-minute thing. Flash mob, get in and get out. The idea is you get in there and you cause chaos, and you do this in such a ubiquitous way that it actually becomes a meme, a national meme. Like, this is known even to new parents sitting in the maternity ward that this is going on. And just out of the pure avoidance of hassle, people will avoid doing it. I mean, can you... people... Middle-class America sort of has apparently this idea that they can basically get through their child's childhood and adolescence without ever talking about circumcision. And indeed, that's generally what happens. The parents and the children never talk about it. If we can attack this early, between the ages of 7 and 8 to early pubescence, or even up through high school, I mean, it's just not talked about. There's something much more basic, which is just that the taboo is not violated often enough. But if you can target it there, you can start causing absolute chaos. I want Little League games to be canceled. I want people not to be able to go to church. I want the schools to be shuttered because of this. Because this is so bad.
Let's try to drag some adversarial people in. I saw Jim in the chat. You missed it earlier. Greg made a one-armed woman cry. He
did.
He triggered some southern female as well. She was screaming at the top of her lungs at him.
I hope I patch things back up with her. I certainly do wish the best for her 6-year-old nephew.
Nah, you might not be able to patch that one up. I'm not sure, but...
Yeah, that's not happening.
She's pretty angry, Greg. But maybe, you never know. Let's see. Let's see if we can drag somebody else. Hello, you're live on the air on the kill stream with anti-circumcision activist Gregory Malchuk. How are you doing?
Hello, can you hear me?
Yes, I can.
Yeah, you're good.
Hello.
Hey there, Gregory. I'm going to be brief. I just wanted to say, you're arguing this from a standpoint of medicine and personal satisfaction when you have sex. I was just wondering, isn't this a very difficult argument to have when I feel like it would be a much easier argument to just discuss the principle of agency? Like, these kids couldn't possibly say no to this. They can't argue against this, so wouldn't that just be a much easier thing to argue?
I agree. I believe that the issues of consent and agency and physical integrity are far more fundamental to the argument. The problem is people really don't want to hear about it. They don't. Anti-circumcision activists have actually investigated this, and people, the basic human rights argument apparently has the least pull in people's minds. People like getting into the nitty-gritty about sex. I guess that's just a human thing. I agree. I think it really distracts from the fundamental points. But then again, I don't really. My plans here are really not to debate this much longer.
What are you going to do instead?
I'm glad to do the talk show circuit. But what I'm getting at with the school protest strategy is to stick a pitchfork into the guts of of society in regards to this issue, largely at an emotional level. The emotional gut punch that people are going to have toward their children, the beans being spilled to their children on circumcision is unbelievable. People don't plan for this. People don't ever actually
might get arrested doing this particular tactic. That's all I'm saying. It might.
Well, it wouldn't be the end of the world. Arrested and probably released. But
hey. You're right. It won't be the end of the world. Happened to me too. So. And I'm back.
Hell thing to go to jail for.
Yeah.
But yes, the conversation can go one of two ways. If you have a kid, mommy, what are those people talking about circumcision? What are those signs about? It can go one of two ways. It can go, oh yes, they cut off parts of babies' penises. It's horrific, and that didn't happen to you. We protected you. Or it can go something like, oh yeah, we cut off part of your penis as a baby because daddy wanted you to look like him, and because mommy thinks foreskin is gross. I've actually seen this unfold between parents and like an 8-year-old kid, and the 8-year-old kid starts screaming and crying.
How did you see this happen?
This was as part of an anti-circumcision protest, an IRL protest. Not at a school where we're ramping that up now, but the street corner protest. There's still people that walk by with their children, and it's the end of the world. The children are screaming, the mothers are crying, the fathers are staring off in a catatonic trance. It's bad.
Sounds pretty bad.
Could I chime in just one more time?
Yeah, go ahead. Get your point in. We're going to drag a couple more people on. We're trying to get everybody in here. So
sure thing. I'll be brief because they are coming after me. Fact that you said earlier that the medical arguments and the personal arguments have much more pull. Wouldn't you say that's because there's so much more gray room left in the middle that they can chime in? And ultimately, wouldn't that hurt you more since it's such a hard argument to make?
Can you explain that again? I'm not sure I understand what you're getting at.
Well, when you're bringing up these medical issues, you were having to bring on these articles, these statistics, and whatever, these medical professionals who want to come in and talk about it.
Right.
Like
and in a way,
so much great room for people to chime in who probably don't know much about it.
In a way, yes. In a way, we really should be pushing these people to the periphery. In a way, I really don't think that the medical field has much interesting to say about circumcision, any more than a medical opinion one way or another would influence our opinion on female circumcision, on foot binding, on neck stretching, on Indian girl biting rituals, on Amazonian tribal finger chopping.
I didn't even know about that one.
Yeah, neither did I.
Yes, there's all kinds of strange specifically child body modifications that go on, and we all consider them to be horrific. And but it's just this particular one that is our own, that happens in our own backyard, that we can't seem to purge from our collective consciousness.
All right, thank you, SF Jellyfish, for coming on, man.
Thank you for having me on.
Yes, thank you. Good question.
All right, we got a couple super chats. Ryan M said, some shekels for making me laugh. Thanks, Ralph and Greg. You're welcome. Eric Mo said, Ross 2.0 prefers his boys uncut. Brush your teeth with a Glock or suffocate yourself with your own foreskin. That was a little harsh. The Red Devil says, Greg, should we get reparations for circumcision? What do you think about that, Greg?
Yes. I mean, talking about reparations, I'm not a big, I'm not really greatly in favor of money payouts, but what I want is a clear societal and government effort to make mutilated men whole, and that means the tissue regeneration research, the implementation on 120 million mutilated men in this country, or as many of them as would seek it, and the necessary medical follow-up.
All right, let me read this comment from Mr. Medicare because I had to mute myself because I was about to choke. He said, a 2-hour stream talking about dicks. It must be like Christmas morning for King of Paul. Damn it. He's definitely watching this right now. He's been furiously jacking it the whole time, I'm pretty certain.
Well, I appreciate Medicare getting your attention the first
yeah,
stream
he's
I was
the
on.
one who pretty much got you into this. We were doing a stream with Scrub, and you got on there, and then I told them, I was like, I thought you would be good for the Kumite, and I didn't really hear anything else about it, so I just brought you in here.
I mean, I assume he probably thought I was a bit of a lolcow, but I think I've done a pretty good job at fighting my enemies to a standstill.
You have won over the chat.
Yeah.
The chat's mostly on your side, I gotta say.
I mean, you gotta give you props. You took on everybody, trolling, not trolling. You just, did what you have to do.
Thorskin, that's what they call him in the chat.
Thorskin?
Adolf Hogg with the next super chat. I'm surprised that he stops at foreskin. Most crazy liberal socialists want the whole thing gone. Yeah, I'm not sure about that. So we got a couple more. Should we bring our favorite Kiwi thought from the Discord into the call?
Yeah, we should.
All right. Hello, band. You're on the air live on the kill stream with anti-circumcision activist Gregory Malchuk.
Hey, Greg. How's it going?
Hello. Quite well.
Yeah, I think we've had the discussion on foreskin before on Discord, right? You come in quite a lot, and you're do your foreskin thing, and then you leave.
Perhaps which server is this?
It's mine.
Oh, Ralph's one. Yeah.
Oh, yeah, yes, certainly. I occasionally chime in.
The Spite Club.
Yep.
Yes.
Yeah. You do a pretty good job of making the Discord pretty quiet as you talk about penises. Can I ask you a question, Greg?
Yes, go ahead.
What are you sexually attracted to?
I'm attracted to women. I'm a straight man.
How do they feel when you tell them that you're an activist for foreskin?
I mean, I don't know. Most of my girlfriends were from prior to my involvement in the movement.
And how long have you been in the movement for?
Well, I've been making videos about this since late 2016. I was trolling YouTube comments maybe since early 2016.
Okay,
I'd been thinking about it much longer than that, though. I've been thinking about it probably since about 2010 or so, 2011.
Yeah. We all think about foreskin then. It's one of my main thoughts.
Well, sorry, maybe it bears more explanation. I was 15 in high school, and I saw a blurb in the back of an anatomy textbook about circumcision and foreskin, and that's what led me on the path here, essentially. It was not talked about at all prior to that. I did not even know what it was.
You don't know what a foreskin was? Or...
No. Well, there were different opportunities. There was a health class situation when I was about 12 where it was mentioned for about 3 seconds, and I had no idea what was being talked about. I made an effort to read the Bible, and I started off in the New Testament, and that's when I was about 13 or 14. And when I came across Galatians, it was getting into this, Judaizer heresy that was being dealt with by Paul himself, the oldest heresy in Christendom. is regarding circumcision. It's so old it had to be dealt with within the Bible itself. And Paul puts down the circumcisionist Judaizer heretics. And I sort of, I thought about it for a second, and I figured, well, I'm not Jewish. Certainly, this does not affect me.
Let me ask you this, man. Well, let me ask you something first. Which I already know your answer. By the way, she's not Australian. She's from New Zealand. Which close, but. John G says, "Do you have a problem with intact men?"
No, I'm from New Zealand. Everyone has their foreskins, so I just don't care. They all look fucking disgusting. They look so fucking gross, dude.
All right.
Well, I don't know. I don't think your meat flaps aren't terribly pretty either, there, honey. That's the most aesthetic thing in the entire world.
Damn.
Don't chew those shitting on men if you're not willing to take it. They're getting dished
You
out.
don't have a hole at the tip of our dick like a naked mole rat. You fucking retard.
Yeah, no, you just have meat curtains hanging to the floor, girly.
I would rather have meat curtains than something that's considered a snake.
I don't like engaging in this. There are people who say, well, all penises are ugly, as sort of a attenuating description. I don't find this. I think that this is just another. I think this
is pretty gay. You'd be pretty gay to say that you like the look of a dick, but
I don't like this line. I don't like this line of thinking. I find it just another way to shit on men. My contention is that both the male and the female human body are unspeakably beautiful in both form and function, and I don't like this effort to say, they're both gross or one's gross. I find it very low rent.
I don't know about that. I've been a feminist for 10 days and I've studied a lot about female circumcision and about male circumcision, and males deserve to be circumcised.
All right, now you're trolling. All right, now you're trolling. Thank you, Ben, for joining us. I appreciate it.
Thanks.
Oh my God.
We had to kick her on that. Let's see, a couple super chats. This is a fairly good point, actually. Irish Pug, what the fuck, says, we have Holocaust, STD, LGBT, anal class, but not baby mutilation class. Who's behind this? And then...
we don't even have decent sex education classes that don't defame the normal male human body. We don't have medical ethics classes that actually cover medical ethics. We don't have anatomy classes that actually teach the anatomy and neurology of the foreskin.
All right. Yeah, she was trolling, by the way. The feminist
Yeah,
bit got shut right up. She was trolling. She was full trolling there at the end. She was probably trolling the whole entire time, but definitely.
I really want to see a conversation between Gregory and Nick Fuentes. I think they would get along very well.
I don't know. Nick the Knife, he likes to slice. I'm not sure, but I'm just kidding. Jesse,
I've spoken with him on occasion.
Oh, yeah? Okay. Jesse James says in Super Chat, can one truly miss something one doesn't remember?
We spoke a bit about this before. I find this to be a very depraved defense of circumcision, because it would be a defense of doing anything in infancy and claiming that not remembering or not knowing what you're missing is an attenuating circumstance. You could gouge out somebody's eyes in infancy and say, oh, they never knew what they're missing. You could circumcise a woman in infancy and claim, oh, she never knew what she was missing, as they do in Southeast Asia, right? Southeast Asia, it is done on children. In East Africa, it's done on pubescent girls. I find it depraved. But that's not even the full story here, because you actually can intellectualize and go out and learn what you're missing and become enraged at what you have lost.
Yeah, I think that's possible too. Let's see, we're getting there. Let's try to bring a couple more people over though. Let's see. This person's been here for a while. Lord Cupcake, you're live on the air with anti-circumcision activist Gregory Malchuk. How are you doing, sir? Uh-oh.
Lord Cupcake, are you there?
Lord Cupcake. All right, Lord Cupcake, you're done. Let's try this dude, because he's got just a generic Discord avatar, so that means maybe he signed up just to talk to us. Hello, John Roberts, you're on the air.
Hey there.
Yeah, what's up?
I just got a couple questions, really. So, when it comes to the state, why should the state actually have to pay?
I mean, there's a moral contention here, which is that the state has actually participated in, by way of Medicaid funding and the promotion of circumcision through the CDC, and has tacitly participated in by not protecting boys under the genital mutilation law of 1997. Boys were originally included, and it wouldn't pass, so they threw us out. I wouldn't care if that were true or not. Simply as a matter of politics, I intend to use the apparatus of the state to achieve my goals. I'm not shy about that.
Okay, maybe it's the libertarian in me that just kind of doesn't like the idea of that. But I understand your point. That being said, it all seems like a tit-for-tat argument. Like, I mean, just because, one's protected but not the other.
Yeah.
Like, I mean, and I'm not saying that you're wrong, like, by any means. I also don't know enough facts about, like, your studies, the other studies, all that shit. It kind of makes it, really hard for anybody to make a genuine opinion because, like, I don't know. Every study has a preconceived set of, like, thoughts.
Again, what study would convince you that female circumcision was okay? This is not a matter of
No, I'm not saying that it would be okay. It's just like the concept is like nobody can truly know what is like fucking right. You know what I mean? There have been cases where it's just fine for anybody like to get a form of circumcision, but at the same time, I understand that it's kind of fucking strange to start cutting on some pussy lips and like fucking take the knife to my dick, you know what I'm saying?
Let me pause it here for a second. My wife has actually intervened. She really wants me to turn on Baked Alaska stream. I won't.
Nah, that's all right. I'm pretty much done anyway. Thanks for having me on the stream.
Yeah, thank you, sir.
Greg, don't yell at any more one-armed women.
Thanks for joining us, buddy.
Thanks. Drag him out for me.
Yeah, have a good one.
We'll check this out for a second. God. The fuck? What is this, Nora? Holy shit, that almost blew my ears out.
Yeah, that was pretty loud, but that's not even Baked's house.
I think he's at Ice Poseidon's house.
That's Ice Poseidon's place. Yeah, they're not even at Baked's house. Ice Poseidon, for people that aren't aware, Ice Poseidon's channel got apparently like a strike or something, so he can't stream. So Bake just gave him his stream key, so he's just been streaming from his channel.
Yeah, this shit looks gay, to be honest.
Yeah, there's nothing to have. I think we missed it.
Somebody in the chat's just like, yeah, I apologize. I didn't know the bitch was going to be screaming at the top for long as soon as I fucking turned it on. Some people are speculating that this is staged. I think that might be a safe bet, actually.
Yeah.
Let's get back to let's get back to talking about dicks. So King of Pole comes back into the chat.
So we can get King of Pole back. We're gonna finish it up in a minute anyway. But let's see who's been in here the longest. Kobold's been there for a while. You're live on the air with anti-circumcision activist Gregory Malchuk. Welcome to the kill stream, Kobold.
Hey, I just want to say this guy did a great job. Like I thought it was going to be like a laugh fest, but he really took all comers.
Well, thank you. I appreciate it.
That's all I wanted to say.
All right, thank you, Kobold. Appreciate it. Who else? Hello, Multi Ruka Show. You're live on the air with anti-circumcision activist Gregory Malchuk. Oh, tell me I didn't waste my little spiel there.
No.
Can you hear us?
I can hear you. Sorry, I didn't see it put me on.
It's fine.
This is one thing I've been wanting to say to Greg. I actually had to subscribe to your channel because one of the mods in the Warski Live said I had to, otherwise I'd get banned. I don't know all the full context, but
what?
Somehow ended up there. Yeah.
Oh.
I don't remember. No. It was like a week or two ago.
I think I remember that. Yes, I've been trolling the comments of Bloodsports ever since I realized there was a large audience of young men capable of being reached in that venue.
Weird out of context, but yeah. So, my opinion on all this is basically more or less just going to carry on how it has been, and having any small or greater effect. Like, you might be able to change a few minds, keep it, but things, I mean, hey, people say this about a lot of things, but most things won't change over time. My 2 cents here.
So you think there's never going to be revolutionary change on this issue, is what you're saying?
I mean, I could have egg on my face later on, but I think you might be able to change a few minds. Maybe a few people won't have their infants uncircumcised, but on the larger scale, I mean, wait and see.
Yes, well, this is the problem I tend to have with the mainstream anti-circumcision movement, which is that they're primarily concerned with pestering new parents or protesting hospitals, which I consider to be hardened targets, as I mentioned before, by virtue of the authority appeal of doctors. They really like the notion of "I saved one boy." A lot of them, that's what they're looking for. I'm not looking to save one boy. I'm looking to save 1 million boys. And in order to do that,
domino effect. Like like how you're saying, it's the father has it like it, so it goes on and on down the line. Like, you stop it once, and it might not pick up for that family line. Like,
yes, yeah. I mean, if we can kill it in one generation, it probably won't reappear. And there's an attrition rate. This has been going on since the late 70s. It's dropped from about 85% down to 45, 50, maybe 45% or so. I mean, there's an attrition rate of maybe 1.8% or 0.9%. We're kind of guaranteed. I'm trying to expedite it. I'm actually trying to cause a mass movement on it, a mass awakening. I'm not content to let this attrition drag on for another 30 or 40 years and claim tens of millions of more victims in the process. I'm willing to spark a confrontation now.
All right, be careful. Don't.
The first I heard about this,
careful what you're saying here. All right, go ahead.
Well, I mean, I'm not going to.
This started because a cornflakes ad. It was something about health benefits with circumcision. I mean, someone can link the video somewhere, but I usually don't watch anything on College Humor, but I found it interesting. Like I said,
this was the Adam Ruins Everything video.
Yeah, back when he was doing it just on College Humor.
Yes. Yeah, that's essentially true. John Harvey Kellogg and other people at the time, William Sayre, they started it as an anti-masturbation campaign because they thought that masturbation was morally bad and caused nervous excitation, causes of disease.
From there's, Rick and that'll get him not to touch his Peter. That was in the actual video, if I remember right.
Yeah, I mean, people laugh about the phrase self-abuse, and they in regards to masturbation, and they laugh about the idea of masturbation giving you hairy palms. And they look, these same people are the people that started circumcision. And if you look down and your penis is mutilated, who really had the last laugh on that one?
All right, Multi, thank you for joining us, man.
Oh, can I say one last thing?
Sure.
As for the whole meat drapes or whatever thing I was saying to you before, there's this video called, it was one of Star Wars Explained ones, called Why Did the Empire Torture a Sarlacc Pit? Just look that up later just for a quick laugh. Just the title, you get what I mean. Anyways, thanks.
Thank you, sir. Yeah, Band got smoked by Thorskin here. I think that's safe to say.
Thorskin. Oh my god, I don't believe that's his nickname.
I mean, she
now.
never really had a chance, though, to be honest. But I appreciate her coming on. Hope she hears that too. Let's see, who else do we have? We got like 2 or 3 more, so we're gonna get them all in.
Let's get.
Hexagon, you're on the air.
Oh, hey.
What's up?
Not much.
Do you have a comment?
Yeah, sorry, I was trying to mute the stream because it was echoing in my ears.
All good.
I was more just wondering, like, in terms of like the Bible, or like the religious, cultural aspects of it. It seems that, like, while a lot of this has been egged on by a lot of religious communities, especially famous one in this corner of YouTube, but that's neither here nor there. Where would you stand on having them allow allow circumcision for religious or cultural aspects?
Religious or cultural aspects? That's basically every circumcision there is.
Well, like religious, like for religious purposes. So, like, because I mean, obviously the Jews have a lot of that, and I mean, taking out the whole weird fucking thing where they suck the blood off the penis or whatever. Like, you know what I'm saying, right?
Yes, I understand. There's a couple problems with this. I mean, American circumcision is a cultural phenomenon. It is a cultural meme. Parents go to doctors in order to act as agents of this meme, but it's largely a cultural meme, which is why I reacted like that. But okay, you're talking about a religious exception. Well,
yes.
What are the problems with it? First of all, fundamental human rights are universal. Your parents being Jewish or Muslim or whatever do not change this. We don't have a religious exception to the female genital mutilation laws. But there's a bigger problem than this, which is that if you claim something is religious, a sincerely held religious belief, the courts, in regard to this matter, do not ask they don't get into they're not going to wade into a 2,000-year-old theological debate of is circumcision religious or is it not religious. They basically take it at face value and move on to some other aspect of the issue. So anybody could claim, oh, I want to circumcise for religious reasons, even if they're not Jewish or Muslim, even if they're Christian. I want to circumcise for religious reasons.
I think there's even an argument that could be made for that one, because even then they still have the Old Testament as a part of the religious text where they do talk about that in the books.
Yeah, I mean, it's a problem, and you have a lot of these evangelical Zio-Christians that are, I mean, some of them are literal Hebrew roots people. There's an actual movement that sees some moral value in LARPing as Jews, I guess, and they seem to be integrating this into their identity as well. Even ones that aren't explicitly Hebrew roots seem to attach some, especially Protestants, seem to attach some kind of evangelical Protestants seem to attach some kind of moral value to circumcision, and it's just insane. I mean, these people would have been burned at the stake in the early church. Paul spits on them.
Press S if Paul spits on them. Sorry,
yes, press S to spit on Judaizer heretics. Judaizer circumcisionist heretics.
Oh, you're going to get a lot of S's. That S's are going to go nuts now.
Oh, man. Thank you, Hexagon. I appreciate you coming on.
Totally.
Thank you.
Zidane, I'll let you pick the next one because we're getting close to the edge.
Yeah,
wow, I'm seeing a lot of S's here. Hold on, let me read these super chats. You pick out who you want. Jesse James says, I just think she has never met a handsome penis. That was in reference to you, Band. Adolf Hogg says, if you think we should keep the foreskin attached, then why don't we keep the umbilical cord attached? Isn't it part of us?
The umbilical cord falls off on its own.
Yeah. Mr. Fister said, Greg, touch a boy's coat and I'll slit your throat, Malchuk.
We need fanaticism in defense of decency and human rights. Certainly.
All right. I'm seeing a lot of S's. I don't think
those S's are going to go nuts.
Chat has not stopped with the S's.
No, it's going to be S's for days.
Okay, so you had one more. This will probably maybe
I got
one
like
more.
One or two more.
Okay, one or two more. Bring them in.
Hey, you're on the air.
Hey, man, I just want to say that
I'm against male circumcision and I'm for female circumcision because it gives women too much pleasure. We've got too many thoughts running around in this chat, talking about, laughing about guys getting their penises cut and everything else. And, you know, they're just flapping in the wind, and I can't stand it personally. I think it's terrible.
There is something. I mean, it's certainly not any more or less insane than the current status quo, but there is something crushingly depressing about the carefree indifference that most women are able to have toward this issue by virtue of the fact that their genitals are totally protected by law, and indeed in this country were never really threatened in any meaningful way.
I'm not black.
Oh, the chat was speculating.
I'm sorry. I couldn't let that go unanswered. No, I mean, I'm saying it in a silly way, but yeah, I mean, if you turned it around, if you started talking about female mutilation and it makes women last longer or it makes women more faithful or something like that, people just go crazy. They're like, oh my God, I can't believe you're saying that. And then, you know, people go, oh, well, it makes men last longer. Me personally, I'm not cut. You know, I'm uncut. I'm all au naturel. I don't know about the rest of the people. Can I ask you, Ralph, are you cut or not? Is that too personal? Are we not on that
I've
level?
revealed this on another stream. I am uncut.
Okay. Gator, is that in?
Intact as well. I think that's a term we're using. We're intact.
Really?
Wow.
This room is full of intact men.
I didn't realize that.
You don't really talk about it.
Intact men here. I didn't realize that.
It's not something that comes up in conversation.
No, it's really not.
How's your dick doing, buddy?
Maybe your conversation. I don't know. I bring it up every chance I get.
Well, we haven't been talking to King of Paul lately, so it hasn't really come up.
Oh, God. Are y'all going to talk about... I saw some video you were playing earlier about that.
Ralph had a stream about it yesterday,
Yeah,
actually.
yesterday we did a stream about the uncut retort. That's what somebody just said in the chat. Oh, man. So, yeah. Bibble, you got anything else, man?
No, that's it.
All right. Thank you, sir. I appreciate it.
Yes, sir.
All right.
All right, one more.
One more.
Hey, Mr. Freeze, you're on there.
Yes, hello. I'd just like to say I really like the job Greg did, patrolling all those Jews, all those thoughts. None of them survived. He completely annihilated them, and I hope to God he has that debate with Halsey eventually.
Oh, we got to get that, don't we?
Yeah, we have to try to do that. That's going to be hilarious.
I'm going to reach out to Halsey. Halsey said, you know, he never backs down, and he always shows up for Bloodsports. So, I mean, the challenge has been laid here tonight. I mean, if he's not a coward, then he'll show up, right? I mean, I guess we'll see.
I certainly hope so.
Right.
I think it would be interesting.
Yeah, it would
Anyways, that's all I have to contribute. I also want to say I am uncut. I am proud of being uncut, and all cut fags need to be gassed immediately.
No, you get too far on the list.
The terrible situation that our fellow men have been put into, I don't think is much of a laughing matter. I feel nothing but brotherhood and compassion and tenderness for all the victims of this practice, and a fiery desire to get them just.
All right. I mean, he was just kidding. I mean, I think.
He was making a joke, yeah. I hope. I guess we'll be okay, regardless, so.
I see some gas canisters in the chat. Yeah, we'll be all right, so who cares?
I disagree with that sentiment very much.
I know, we're kidding, Greg. Chill.
It's a joke.
I know.
We're kidding. Thorskin, you have won the night, sir, I have to say. You really have. Do you accept the Thorskin moniker? Chat loves it, by the way.
Certainly. I will henceforth be known as Thorskin.
Yeah, man, I appreciate you coming on. You know, we just did this off the cuff, like literally 3 hours before the show. I said, I really don't have much to talk about tonight. Just rehash the same shit that's been talked about the last day or two. And I said, you know what? I know a guy who talked to me, and he really wanted to come on here. And we didn't have anybody in particular set up, so I said, let's just open up the lines and let people go.
Yeah, and it was...
Yeah, This was a very, very nice very interesting format. I don't get to interact with people like this on a.
We love the chat. We love talking to them. We love having open nights. It's great.
Yeah, we used to just do open night on Friday, but that's kind of started to be like a
our thing.
An open, like a aspect of our show that we embrace. So, yeah, man, we're gonna try to get you back on with Halsey though.
Okay. Well, I certainly I appreciate any help in that regard.
All right, man. You got anything else you want to plug real quick before you go? Or
yes, if I might make a final plug. My name is Gregory Malchuk. I have a YouTube channel under the same name. I'll be putting out a video fairly soon. I think I mentioned this before, summarizing everything that I'm about. Mainly the goals and the means of achieving these goals of my anti-circumcision campaign. And in general, I have to say we have to be willing to engage in radical protest strategy in order to split hell wide open and pour sand into the gears of civilization of this country and torture it into complying and caring about this issue. And I urge you to join me on my channel where I talk about this nonstop. And your willingness to engage with me and engage in this radical protest strategy that I'm proposing will directly influence the time until we have a circumcision ban, we are punishing the perpetrators, and we are getting that government funding for massive programs to regenerate our foreskins and make our bodies whole again. The time until you are made whole is directly impacted by your willingness to engage now. So I urge you to join me, Gregory Malchuk, on YouTube. Thank you.
Thank you, sir. Appreciate it, man. You have a good one. Look, he just changed his Discord name to Gregory Thorskin Malchuk.
I was the one that did that, actually.
Oh, okay.
Type 1's in chat for Thorskin.
Yeah,
let him feel.
Type 1
let him feel
if you think Thorskin won the night. Press 1. If you don't, press 2. We'll let chat decide. Thank you, Gregory. Appreciate it, man.
Thank you. Take care.
You too.
Thanks, buddy.
All right.
Chad is calling him Thorskin the Thought Slayer.
He was slamming thoughts left and right.
Dude, he was slamming everyone.
Wow.
It didn't matter. Left or right. Dude was just hammering.
Thorskin.
Wow.
I've seen
that was...
Wow.
Oof.
What an evening.
All right,